Hi, my name is Catherine Ross and I'm the Chief Healthcare Science Officer at Scottish Government. And I'm here to introduce the shortlisted projects for the Scottish Government Awards for Driving Improvement, Delivering Results. Innovative delivery of service is key to how we develop our healthcare services as we move forward with remobilisation. And I'm delighted to see such high calibre projects submitted to this category this year. The shortlisted projects are hearing checks at home for children and young people with a learning disability, autism or both, and that's NHS England and NHS Improvement. National Demand Optimisation from NHS Scotland, and Blood on Boards from the Belfast Health and Social Care Trust. Now let's hear some more about them.
We are so excited to have been nominated for this award. Working with children with learning disabilities and autism and trying to understand how to do hearing checks in residential schools has been a key piece of work in the long-term plan. However, through the pandemic, Jack and I had to come up with a pilot that looked at using innovation and digital technology to support this work, but in the children's homes.
So we collaborated with the Children and Young People's Audiology Centre at the Evelina London to implement this innovative project. We spoke to the parents about their motivations for taking part, which included the barriers to accessing care, which included the environment and unfamiliar people in the hospital. So the team at Evelina London trained the parents on how to use the equipment virtually, and the parents delivered the ear checks at home. As part of the project, we were able to significantly increase the number of children tolerating ear checks at home compared to the clinical environment. And we spoke to parents about their perceptions after the project, and they felt that the key facilitators to success were familiarization to the equipment, the home environment, and also timing, be able to perform the test when the time is right for the child.
We've done that, and what do we do next? Well, we've been really successful in putting forward a business case based on the pilot to take this out to the regions. So we're on a roadshow this year, taking the pilot out alongside the co-production collaborative to see how else we can innovate in this space and really make sure that we start to do hearing checks on children with learning disabilities and autism in residential schools. Thank you very much.
Thank you.
The National Demand Optimisation Group was set up under the auspices of Scottish Government's Healthcare Science National Delivery Plan and is a collaboration of staff groups working across laboratory medicine, including healthcare scientists. The programme is focused on minimising unwarranted variation in laboratory test use. Through 4 distinct phases, the programme has utilised sharing of best practice, implemented minimum retesting intervals, initiated request rate monitoring, and promoted standardisation of laboratory practices and test repertoire. Much of our focus has been on developing an online interactive atlas of variation using a wide multidisciplinary approach with outcomes aimed at better lab services, better patient services, and ultimately better patient outcomes. The interactive atlas provides tailored laboratory requesting views from health board down to GP practice levels, thus enabling scrutiny and intervention. The atlas has been modified during the COVID-19 pandemic to provide valuable information on lab test use. These dashboards will enable health boards and specific services to monitor and track their services and allow focus and prioritisation decisions to be made. Demand optimisation. Driving appropriate laboratory testing is good for labs, it's good for the wider NHS, and it's good for patients.
The Northern Ireland Helicopter Emergency Medical Service, or HEMS, was launched in July 2017 and cleared to carry blood on board from December 2019. HEMS is delivered in partnership by the Northern Ireland Ambulance Service and Air Ambulance Northern Ireland Charity. In air, blood transportation is logistically challenging, as many of the protective safeguards of a hospital operating environment are not present. Blood must be stored between 2 and 6 degrees Celsius, but it must also be warmed to body temperature so it can be safely given to patients. If these strict temperature levels are not maintained, blood can be damaged, it can lose its effectiveness or even become dangerous for a patient.
This initiative brought together key stakeholders working in close partnership to ensure the safe delivery of blood in the pre-hospital environment. We have introduced an effective standard operating procedure and robust governance structure to safeguard this groundbreaking service for the province. 23 patients benefited from blood transfusion within the first year, receiving a transfusion on average 40 minutes and 46 seconds quicker than they would previously. Through this partnership, a doctor and a paramedic team can now offer pre-hospital blood to patients suffering from major hemorrhage, making a significant difference to those who have suffered life-threatening blood loss.
The judges said this winning project was powerful in terms of inclusivity and its potential to tackle inequalities within communities. It is clear and innovative, benefiting patients and their families, and with great potential to roll out across the UK. And this year's winner is NHS England and NHS Improvement, with hearing checks at home for children and young people with a learning disability, autism or both. Congratulations.